Is Asenapine safe during pregnancy? Have you ever wondered about the safety of medications during pregnancy? Today, we will talk about Asenapine, also known as Saphris, and its use in treating schizophrenia during this special time. Asenapine is an atypical antipsychotic, which means it belongs to a group of medications often used to manage schizophrenia. However, when it comes to pregnancy, the safety data is not extensive. Currently, there are no large studies that specifically look at how Asenapine affects pregnancy or fetal development. Most of the information we have comes from studies on atypical antipsychotics as a whole. This means that while we can gather some insights, we cannot make definitive conclusions about Asenapine alone. There are potential risks associated with using atypical antipsychotics during pregnancy. Some studies suggest that these medications may lead to low birth weight or preterm delivery. Additionally, babies exposed to these medications in the third trimester may experience withdrawal symptoms or unusual muscle movements after birth. However, it is important to note that these effects have not been conclusively linked to Asenapine specifically. When considering the use of Asenapine during pregnancy, it is essential to weigh the risks and benefits. Untreated schizophrenia can pose serious risks to both the mother and the baby. These risks include complications during pregnancy and a higher chance of relapse into psychosis. For some women, continuing treatment with Asenapine may be necessary to maintain mental health during this time. Another factor to consider is that pregnancy can change how medications are processed in the body. This may requiring adjustments in dosage to ensure that the medication remains effective while minimizing exposure to the fetus. Breastfeeding is another area where caution is advised. While Asenapine is approved for use in adolescents with schizophrenia, there is limited data on its safety during breastfeeding. Other antipsychotics are generally considered safe during breastfeeding, but careful monitoring is still recommended. In summary, while Asenapine is an effective treatment for schizophrenia, its safety during pregnancy is not well established. Decisions about using this medication should involve a thorough evaluation of the mother's mental health needs and potential risks to the fetus. Working closely with healthcare providers is vital to ensure the best outcomes for both mother and child.